Thank you, Palma, for having me today. Um, I've, um, I'm very happy to present our project that's going to start. Actually, it has started just this year in May, about personalized predictions. These are my disclosures. It's an European sponsored project from the European Commission, Horizon Europe. I'm happy to do that with actually 13 partners and 3 allied partners, so 16 in total. A big project because we need big data. So cardiovascular diseases, as we all know, is number one cause of death. And it actually affects our patients that we vascular surgeons are treating, aneurysms and peripheral arterial disease patients. It's not only like prevention of rupture that we want to do with these patients, so progression in the disease into rupture, but we also want to prevent in peripheral arterial diseases adverse limb events as well. But these patients have much more. They also have myocardial infarction, high risk of stroke, heart failure, or heart valve disease, or arrhythmias. So these patients not only have progression maybe of the aneurysm or peripheral arterial disease, but there's also need for technology to predict not only these disease progression, but also the cardiovascular events in these patients. So therefore, we need a personalized diagnosis and treatment for these patients, and not only following the guidelines that we heard about today, but more move over from guidelines from men and women to a personalized approach. So the Vasculate project is an European project and ESVS is highly involved in that prediction of vascular disease progression and the risk of cardiovascular events in the large group of patients that we treat, the AAA and PAD patients. So how does it look like? So we have 6 clinical centers that collect retrospective data. We just have a data dictionary made between these centers. But we also are collecting data from existing biobanks, existing registries, over 20,000 patients, hopefully, from these existing data registries. And we will develop a prediction algorithm, but we also use prospective data in a cohort of 1,100 patients to refine that algorithm, but also to validate it for a personalized cardiovascular and disease risk platform. So right now we have made the data infrastructure, we have an extensive data dictionary made and agreed on. We have an electronic data record, patient-reported data, and we have set up an XNet Health RI imaging server that we can share all the images and run our algorithms on. So it is a holistic approach, that's what I call it. It has not only clinical data from patient characteristics, but also genomics, proteomics, and lipidomics. And what we know from the patient's records, we have blood pressure, smoking, medications, quality of life. But in a prospective study, we will also collect the physical activity like walking, heart rate, blood pressures, and how it relates to the quality of life. We will, we will put it all in and make different AI tools actually. So the image data will not only result in a prediction, but also is an automatic image analysis tool. We'll make a risk prediction tool with the patient characteristics added on it and the cell data. And we'll make a patient communication tool because it's a patient-centered approach. Because of the aging population right now, we don't want to see all the patients coming into our hospital. We want to see the high-risk patients and place actually the care into their own hands. So we hope to make an explainable AI and that they see how the risk will change every 6 months, and a lifestyle data collection tool of their lifestyle. So what is the platform about? Personalized prevention strategies. So we want to see what is the 30% of high-risk patients that have cardiovascular disease progression or MACE or MIL, and refer them to the right doctor, the cardiologist or the vascular surgeon for the treatment early. And the low-risk patients don't need to see a vascular surgeon, and they maybe need some small adjustment in a medication lifestyle, but that can maybe done by the general practitioner. So it has 4 pillars. So we are making a standard European vascular disease data infrastructure. This is a framework that also other AI algorithms can run on. An AI-based vascular disease progression, risk prediction tools, that's what we are developing, and an application integrating AI and data visualization. So we want to visualize AI, but also for patients and for clinicians to help them understand AI, explainable AI and visualization, and want to validate it. So this is the first platform that's actually going to validate the algorithms, because we follow these patients up to 4 years to see if the algorithm is correct. Is it that this patient will have a disease progression, and that we will follow these patients 4 years, and if is it cost effective? So we have 8 work packages. So work package 2 is this whole data collection, and 3 and 4, 3 is based on AAA, 4 is PAD, and these have the same things: automatic image analysis, omics analysis, risk prediction, patient communication, and lifestyle data collection. Work package 5 is a prospective study where we collect everything, and 6 is to see if we have quality improvements, cost savings. But 7 is one of our most important work package. And that is because we have in our project someone from the EU Commission that does the Regulatory AI Act, because what are we doing? Is that ethical? Is that legal? So ensuring legal and ethical alignment of the platform. So prospective and the retrospective algorithms are created under this AI Act that we have in Europe right now. And that means that there's regulations for using AI. And that is to raise trustworthiness, of course, for the users. So the current updates: we started hiring people in May, and we had a kickoff meeting in June. We are conducting right now the Delphi studies with the patients. The patient-reported standard outcome sets for AI. So not only for PAD and AA, but specifically what do they want to know also in their app, and how can they communicate about this disease. The image analysis has started. I will show you a little bit some examples of that. We have a website, data infrastructure is built. We have ethical approval right now, the AI Act. We have workshops going on that. We have aligned the protocols and the data dictionaries, and we started with the pilot studies of the proteomics data. This is just an example how difficult the infrastructure is of the data flow chart. So not everyone is doing the same thing. So how it all comes in, that is pretty difficult, and we have also a data management plan for that. So this is an example of what we do with all these images that come in. So a central line extraction of the whole image, actually the whole aorta. So we don't have to do anything. You just load in the image, and we have a central line. Then a central line can predict the growth. So you stack. So we make actually the aorta like a hollow organ. So the vessel is modeled like general cylinders, and you put stacks of cylinders on top of that, so you have a lumen inside, and then you can predict actually how the longitudinal growth will be over time by analyzing all these consecutive images. This is how it looks like. So in the p-value at the middle, that is actually the central luminal line, and then you have a mesh that forms around the aneurysm, and then the prediction goes actually, this is a ground truth, and there's a prediction how the aneurysm will deform over time. So this is an example of what we do with all these images. We can also have these mesh neural networks that already is there, like I showed in the image before, to have pulsatile flow and mimicking flow dynamics, all for the prediction of this will lead to growth or not. So right now we are at the TRL 5 level. That's what we want to achieve. And the vascular project will run to 2029. So thank you, the team. This is in Amsterdam, but of course all our partners in Europe.